Health for All is a fight for equity and inclusion of all Californians, regardless of their immigration status.
The Health for All campaign was driven by undocumented immigrants.
Ensuring that everyone had health coverage was the primary goal at the end of the day.
I think building healthy communities and Health for All were kind of the perfect marriage. We had hoped that with the Affordable Care Act there would be an opportunity to cover everybody.
Cerca de 1,5 millones de indocumentados en California vive actualmente sin un seguro médico.
We had to acknowledge that across our 14 sites, a significant number of our residents were undocumented. They were specifically excluded from the Affordable Care Act.
It makes all perfect sense in the world to make sure that these people who are living in our community, contributing economically, that they have basic, dignified access to health care.
The Affordable Care Act wasn't the end of the work, it was the beginning of trying to get to a fully inclusive healthcare system.
In 2013, we set out on the Health for All campaign, and we knew that the first thing we had to do was change the narrative. We couldn't enter a debate about whether we should expand our healthcare system when people perceived undocumented Californians as illegal or as takers. We need to change culture before we can change policy.
The Health for All campaign began by mobilizing the immigrant rights community. It was the community who shared their stories.
My aspiration is to go into the world of medicine and to become myself a doctor. It is ironic the fact that my parents themselves won't be able to see me as patients, if I were to become a doctor tomorrow.
Our stories and our struggles are very powerful and can change policy, can change values, can change culture.
It's definitely very important for the people that are impacted by the issue take ownership over the issue. And that's really what we saw with the Health for All campaign.
Health for all! Health for all!
Changing the narrative and changing culture meant creating innovative partnerships with multicultural media, with celebrities.
Healthcare is a basic human right.
And getting our storylines and TV shows.
You can't do that, you don't understand. We have no papers, undocumented.
We had to have all of those elements, press conferences, t-shirts, meetings, just to make sure that everybody knew that we were fighting for healthcare for all.
The simplicity of the name of the campaign, Health for All, and the fact that it was a hashtag, it wasn't an accident. Everyone was linked by this campaign that just called it out. We want health coverage for everyone in a very simple way.
Now our country has spoken,
saying that everyone should have affordable health care.
Does that mean everyone?
Yeah, pick our crops, yeah, build our houses, yeah, clean our hotel rooms. But when you get sick, now we're going to play high and mighty and say, you're undocumented, you're not legal, you're this, you're that. That is so un-American.
It changed the narrative, right? The undocumented population, they're not other people. They are our neighbors, they are our friends, they are our family members. They're in our communities and trying to be productive citizens.
We brought together a strong coalition of grantees and partners to help us do this work.
The coalition is a very diverse group of organizations that are grassroots, faith-based, labor, immigrant rights, health advocates coming together in a unified voice to advocate for Health for All. The diversity of the coalition is one of the main ingredients to our success.
Many counties serve undocumented folks, but others do not. What a lot of local advocates, including those in building healthy community sites, were seeing was a new opportunity to expand access to this population.
Fresno County has paid community regional medical centers $20 million a year to care for the poor and undocumented. But now the Affordable Care Act has covered most of the poor, but not the undocumented. That leaves Fresno County wondering what its medical obligation to the undocumented is.
In some cases, it was to preserve access, like in Fresno.
We're not asking everything for free, you know. We pay our taxes. Healthcare is a human right. We all deserve it.
In other cases, it was to restore access that was cut during the Great Recession, like in Contra Costa and Sacramento. In other cases, it was to take a new step forward with a program that would include the undocumented, like in Monterey or like with the 35 rural CMSP counties.
Our residents who have been shut down, stepped on, pushed out, are standing up and saying, no, my voice matters, and I'm going to speak for people who won't speak for themselves.
I would like the Board of Supervisors to take a look at their community and help us to stay healthy.
How do we have people power?
People power, I think that's what it all comes down to. There's only one balance for the out-of-control influence of the most wealthy, most powerful, and that is people power.
In the span of just 1 year, we went from 9 counties that served the undocumented outside of the emergency room to 47. A big step forward, but more to do.
They wouldn't take you at the doctor. And how'd that make you feel?
Like, even more pain.
We knew that this wasn't the end of the story because we needed to make sure that everybody had coverage. And so we needed to really make sure that this conversation was happening at the statewide level.
In my view, it's morally the right thing to do.
So all of the policy wins that we were seeing on the ground, the surround sound that you saw across the state, led to a greater political will at our Capitol. You saw leadership saying expanding health coverage for the undocumented was a priority.
Health coverage for all, regardless of immigration status. It's a controversial proposal working its way through the state.
Legislators were actually asking, how do we make this possible?
We want it all. We deserve it all. Our communities work hard.
Senator Lara actually named his bill after the Health for All campaign name because it had people power behind it, had an authentic voice behind it, and it invoked the idea of narrative change.
We need to make sure that our undocumented Californians have an opportunity, and that's what we're giving them today.
The bill really helped to galvanize us because, now there was something on the table.
The biggest force of local undocumented workers would be eligible to buy health care under the state exchange if Senate Bill 4 passes.
The question was no longer, should we cover the undocumented? It became a question of how.
And in May, we'll start providing full health care coverage to the children of undocumented workers.
In a very surprising and bold move, our governor expanded Medi-Cal for all children. So regardless of immigration status, all lower income children will now have access to health coverage.
California vuelve a hacer historia al aprobar una ley que ofrece cobertura médica a todos los niños sin importar su estatus migratorio.
That was huge for us. To be able to have at least children get health coverage has been great.
Y ahora podemos festejar que por fin hemos logrado que todos los niños tengan como derecho el cuidado de salud.
What it means now is that in California, every child on every playground and in every classroom now has access to affordable health coverage. It's a big win on its own, but it's also a big win as a step toward the full solution.
Thank you everyone for being here this morning.
But there is a lot of work ahead for us. We want to make sure that everyone in California has health care, and that includes all undocumented people in our state.
It continues to be a patchwork. We used to have 7 million uninsured in California, and now we're probably down to around 3 million, but there's still more work to do.
Estamos muy agradecidos, la lucha sigue, viene mucho trabajo por hacer. Necesitamos un seguro médico para todos en este país.
Until we get it through our thick skulls that universality means universality, like virtually every other developed country in the world, we're going to struggle with these fragmented systems. but we've made major progress in California in pushing our systems towards universality.
We all live in the state. We all contribute, and it's up to all of us to make sure that everybody is healthy. We're a community at the end of the day, and if our neighbor is sick, we need to take care of him.